3 words to describe a school mental health champion are passionate, tenacious, and resilient.
Advocacy, relationships, and consistency.
I think it takes perseverance.
Awareness, a collaborative spirit, a willingness to think about things differently.
Collaboration and partnerships.
Passion, having some integrity, and taking ownership of it.
To be able to have a consistent, collaborative leadership team.
Being willing to put yourself out there and really be a voice for students who may not have a voice.
Right? We stand on the shoulders of giants. It's boom, 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 boom. So the imagination is what's happening after us. Who's going to stand on our shoulders?
This project allowed us to raise awareness about an issue that so many students face and gave us the opportunity to really try out some things within our systems that might improve student access to mental health services and support so that they can be successful in school.
Project Aware and some other community members came together and started a conversation about what supports our schools needed, what was currently going on in the school systems, where were there gaps in services, and where community partners like myself, our agency, where we could fill those needs for the schools.
But I think once you get who at least you can get there, and then you can identify like who is missing from this table and who here has those relationships that can bring some of those people in.
A lot of our efforts have been siloed for a very long time. And so the opportunity to reach across to your community partners and really understand what your goals and intentions are based on needs and identifying what those needs are through data is, there's a deficit. And we've gotten away from looking at that data that really supports the individual children, the staff, the teachers, the administrators, the communities, the families. It's a collective work.
So we are all working from not just the same book, not just the same chapter, but we're right in there, paragraph by paragraph, coming to agreement on the best way to work together. And that it means trusting one another. It takes time to get there. It means having some real meaningful dialogue and to take some real close look at how can we change to better improve and meet the needs of our children, youth, and families together.
Well, partnership in our community allowed us to do some things that we had never been able to do before, from braiding funding resources that we had never braided funding before.
And so I think Project Aware and that Transforming Youth Suicide Prevention Grant were able to work together to combine their resources and provide, this specific school had a high instance of suicide attempts, suicidal ideation reported, and so being able to provide support and training to the staff, to the teachers, to the students was huge.
We found that having somebody in a supervisory or management level who was responsible for overseeing those elements helped to really make the work happen. So it's important not only to have the input from leadership, but also to have management at the table as well.
All of the frameworks that have guided the work, whether it's multi-tiered systems of support, whether it's the interconnected systems framework, whether it's the whole child framework, all of these frameworks are about addressing all of children's needs. Those needs are met by a variety of services provided by a variety of providers, and so there has to be a way of integrating and connecting that so that it operates efficiently and effectively for each child.
We need to be able to periodically celebrate the successes that we have, because there's tremendous barriers and obstacles, and there'll always be setbacks. So we need to look at those and celebrate those accomplishments.
The number of people who have been attending our school mental health collaboratives that we have each quarter just continues to grow. And the feedback we get is, thank you, we need this, we need more of this. The number of schools who have asked us to come out and do trainings with them continues to grow. That's exciting, and that's a big victory.
I love that the work of Project Aware started as like, let's change student outcomes, and then actually morphed right into how do we change adult mindsets.
So youth mental health first aid training shifted how people thought about and understood mental health issues in school. That transformed into changes in school climate, because if people are thinking and understanding behavioral issues differently, so instead of these children are misbehaving, they're naughty, they should be punished. No, these are kids with behavioral health issues that need to be addressed in a compassionate and comprehensive way.
I get the privilege of walking into 45, 46 school buildings across our county on a regular basis just to see the staff that I support in those buildings. And I notice the difference. You can feel the difference when you walk into buildings. Those who are doing this work, who are focusing on building positive and supportive, healthy climates and school cultures, and are focused on the mental health and well-being of school staff and students, you feel the difference. And that's going to bring more families into the work, that's going to bring more community partnerships into the work, but ultimately it's going to bring more students into the building every day who feel like they want to be there.
Social emotional learning is just as important as academics, and there needs to be balance between both when you're looking to have a successful journey in education.
The biggest challenge we experienced in our county around Project Aware and growing our champions for mental health in schools would be buy-in from administrators who really are focused on academics and helping to make the connection for them about how mental health and academics are directly linked and how they support each other.
In 5 years, what I would like to see happen is that there's more community partners at the table, that we are working collaboratively together to really and truly support districts as a whole. Having assigned mental health professionals and agencies take on that partnership with those specific school districts to be able to customize and meet their needs and kind of balance and spread out the work within the community.
I think the invitation would then be for state partners or stakeholders to join alongside them and to offer resources or support or guidance documents perhaps, but to really let our local intermediate school district or school district teams lead the way.
At the end of the day, what I care about most is healthy, whole children that can grow into productive citizens in our community.
If they truly care about school safety and reducing the number of school shootings, that this is a piece of the puzzle, one piece, and it's an important piece because it's going to help us to make sure that all students feel like they have a sense of belonging.
This work is going to continue to grow and ebb and flow, and we're going to carry it and advocate for it in so many different ways. And the closure is not because the funding ends and a grant goes away or a position goes away. It is the ongoing onboarding and advocacy that we need to be doing as humans, and that's going to look differently for all of us, but we can do it.
This is the interconnected systems. Right? This is how the work happens. There's no such thing as alone.